James.
Yes, sir.
How do I prevent my SI from getting injured?
By getting the biggest, strongest booty ever.
Da-doing. What is the SI joint?
Oh.
Tune in to the 50 Shades of Pain show and find out. Welcome to the 50 Shades of Pain show, where we empower our community by demystifying pain, both physical and emotional, to give you the tools that you need for optimal health. I'm Dr. Danish, the medical director of Wellward here in Lexington, Kentucky, and I'm here with Dr. Escaloni, my co-host. And today we're talking about the booty joint.
The SI joint.
Stands for
Sacroiliac joint.
And that means the sacrum, that triangular bone, right here in this part of my bottom, and the ilium, which is the iliac crest, where you would put your arms if you were upset with your partner. That's your ilium, and these two connect to make the sacroiliac joint, which is the pivotal joint connecting your upper body to your lower body. Now, if you read through orthopedic textbooks, they'll be like, SI joint pain doesn't exist because it's not a joint, it doesn't move. It moves about 5%, but it's actually a really critical structure because joints, in addition to creating movement in the body, they're also reservoirs for stress loading that distributes forces elsewhere in the body. So it's kind of like it absorbs this kinetic energy going through the body, and then it releases it in a different direction. And that's exactly what the SI joint does. If you ever watch somebody walk or run, it's more of a controlled fall than it is a graceful motion. And it's because the body is absorbing all of that kinetic energy into stored energy in your sacroiliac joint, in your knees, in your hips, and then releasing that every time you take another step. So that's why it doesn't take as much energy to maintain movement as it does to create movement. Mm-hmm. But the SI joint has a little bit of dynamicism, if that's a word, to it. And it does get injured. It's actually quite a common cause of low back and pelvic pain.
Now, if you've listened to our podcast, which I highly recommend you do, you'll learn quite a bit about this. And there's two ways that you can try to create a little bit greater stiffness or control of motion at the pelvis.
A big booty.
That's going to be the most important thing that you can really do a lot about. And if you have done that and you can't get that thing to stiffen up like you need to, you might need to see us in the office. But we're trying to prevent you from having to see us, all right?
And when I say big booty, I don't mean Brazilian butt lift booty. I mean muscles.
Earn it, don't buy it.
Earn it. That's right. So how do we get that thing started? How do I magnify my booty?
So for this is a concept in which we're just trying to create some sort of activity of your gluteus maximus. Some big precursors for this. If you are trying to build this muscle for aesthetics, or just get that aesthetics for there you go, to try to help yourself out, or if you're trying to actually prevent pain at the SI joint, this even helps out with your knees, your lower back. It's the best muscle you can do to just try to help your body to be more athletic and not be in pain. Then you need to do one of these exercises in a challenging way for a full set so you feel, man, I am tired. That's called a stimulating set. You need to be able to do about 10 of those over a course of a week. Minimum.
10 sets.
Yeah, 10
Not
sets.
10 repetitions for a set,
yeah,
but 10 sets. So if you're getting 10 repetitions per a set,
up, down, up, down, up, down, up,
you're
down,
looking at
10 times.
100 of these throughout the course of the week.
Yeah, it doesn't have to be in a day. You can just do a couple sets on a Monday, a couple sets on a Tuesday or Thursday. Just make it add up to there. That's the bare minimum of dosage you need to make a big change for this muscle. Mm-hmm. So any of these exercises will do great for that. It's just once you get the hang of it at home, so you really feel the gluteal muscles working, you need to then plan it so you do it a certain amount in the week. All right, let's take a look at these. First one.
Number one.
We're going to do a glute bridge. So when people are doing a bridge exercise, you would have somebody lying on their back just like this, knees in the air and your feet flat on the ground. Many people just lift up their body, but you'll notice that, and I've definitely noticed by giving this to a lot of people over the years, like a lot. If you're really strong in your back, but not so strong in your rear end, your body will naturally use the strongest muscle around to get the job done. So you're more likely to feel your lower back doing the work, which can increase the discomfort during the exercise. How you can fix this is a couple ways. So start by squeezing your glutes really hard. Hold that for about 10 to 30 seconds. And then after you're really starting to feel the cramping of your buttocks, lift yourself up by that cramping of the buttocks. All right? Hold that for 5 seconds and lower yourself down. Now, what happens often is if people are not efficient at using their glutes, then I guarantee one of these hamstring muscles will cramp up. It's going to happen. All right, but you're not going to damage anything. Just stretch it out, move it around a little bit, shake it a little bit, and try it again. You're reteaching your body how to do something, and it's just showing you that you're stronger in that hammy area than you are in your butt. Retrain your body. All right, I recommend doing this exercise 20 repetitions for a 5-second hold. All right, cool. That's exercise number 1. Now, exercise number 2. All right, this is a great exercise called a good morning. My younger son, when he used to help me teach stuff like this, he would do the cutest thing. He would say, good morning, like that. All right, when you're doing a good morning, what it is you want to stand up nice and tall. All right, and I'll have Dr. Donish, who's my great, gorgeous model right here.
Look at that booty.
He's been doing these. Now, your feet should be tight to the floor. Your shins will remain vertical. Now what he's going to be doing is he's going to imagine that he's got some sort of weight on his shoulders right from here, and he's going to be reaching his tush backwards. Okay. Now you see what he did? He's got his shins going backwards a little bit. At first, make this easier, just like this. That's about it. His shins are staying vertical. Now from this position, he's going to squeeze his butt and push forward. All right. Seems pretty simple. But for most people, when they do this,
The coordination's a lot harder.
yeah, for most people, when they're doing it, they're using their back and their legs too much. So if you have some sort of jump rope, rubber band, large belt, this can help for learning for yourself. Here's what you do. You put this around the person and put it on their belt line. This is a great teaching tool. I'm going to pull back on Dr. Donish, and he's just going to kind of go with it and let his hips drive him back to take that pressure off. There you go. It's hard. Good. Get the butt a little higher. There you go. He's going to hold that for a second. Then he's going to squeeze his butt. Now he's going to pull forward. There you go. All right.
Really put your attention on squeezing that butt.
Yep. When you get that pelvis moving forward, then what's going to happen as you start to bend forward, come back up again, you're going to feel your buttocks doing the work. The problem that happens for a lot of people when they do this exercise is if they're not doing it correctly, this is when they start to feel their lower back doing the work. How you should do this at home is you should be doing this 10 repetitions, but a 5-second hold at the bottom. And make sure that when you come up, you don't really feel this exhausting your back, but you want to feel your legs doing the work and the hips. You would not believe the amount of very experienced athletes who lift weights for years, and when they do this, they say it hurts their back. And just by doing this, they say, hey, nothing hurts anymore. All right, so number 3. All right, this is for the inner thigh area. All right, this is a challenging exercise that is used quite a bit in soccer sports so that they do not have groin sprains. And the groin, your inner thigh muscles, attach all the way on the bottom part of, guess where? The SI joint. So we got to concentrate on how we get all of this stuff grooving and moving together. All right, so we'll start with an easy version of this one. Dr. Donish is going to be scooting his body so he has a bench or a chair or something that's kind of soft, and his knee is going to be up on this bench. Good. By starting in this position, this is going to stop him from having any sort of extra strain on his knee joint. Okay? The top arm is going to be in a side plank position, right? When you're in this position, you want to keep your ear and your shoulder away from each other. See what he just did right there? That's going to help protect his shoulder and rotator cuff. Now the last part of this, and again, this is the most advanced exercise right here. It's when you got to build up to. He is going to, while keeping his bottom knee on the ground, bring his hips up into the air. And he's going to hold this for 10 seconds for his very first time. Again, the bottom leg is on the ground to make this a little bit easier, and then he's going to come back down again. Okay? As you can tell, he's experienced and very good at this one. His shoulder didn't come anywhere near his ear. He came up into the air. He felt his thighs doing some good work. It's awesome.
A couple years ago, I had a labral tear and had a couple of PRPs on that labrum, and this was the exercise that I did practically every day until the labral tear healed in combination with that PRP.
And now he can do all the advanced versions, which you're about to see.
Next.
So from here, after it gets kind of easy, what he's going to do is he's going to come up in the air, but he's going to take his bottom leg off of the ground after he's up there. So he's taking the bottom leg up and down. Good. All right, and back on down. Now once that starts to get easy, he's going to scoot out, and he's going to do the exact same thing, but he's going to have a longer lever arm. This is going to increase torque on the SI joint and hip. All right, he's going to squeeze his butt forward a little bit, because that's what everybody does. And then he's going to hold this leg there. Kind of a plank for your thigh muscles. Kind of hard. Back on down. And then to make it even harder, you go back up again and you take the bottom leg, you bring it up to the other top ankle and back down again. Good, and he's just moving that up and down. Holding this nice and tight, holding your torso still like a plank for about 10 lifts up and down. Now, if that's still easy for you guys, one, you shouldn't have any bits of SI joint pain, but two, you can make this go higher. Some people are already very, very naturally flexible, and you need to train the strength in that range of motion. So if you're a part of that crew, then you need to have this foot not on a bench, but something much higher, whether or not it's a piece of furniture that's nice and stable, or even somebody holding onto the ankles. Now, I'm not going to do that to him because I don't trust his pants to be able to hold that distance apart, and I don't trust mine either. So you can imagine what that looks like, holding somebody else's leg in the air as you move that back and forth. And those are the best SI exercises that'll help you out to prevent injury. Now, each of these you can definitely build up with some strength over time, and you need to, because if you're not challenging your body, then your body has no reason to change and be better.
That's right. So whether you're looking for a Brazilian butt lift or you're looking to keep your SI joint healthy, these exercises can help. And for more information, you can look us up on our webpage, wellwardmed.com. Check us out on our podcast.
Yeah.
That's right. The Wellward Way Show.
Yeah.
Or just hang out here with us on YouTube and check out our YouTube videos.
Yeah.
So for all of us here at Wellward, I'm Dr. Donish.
And I'm Dr. Escaloni.
And we wish you growth and joy on your Wellward Way.